Hi, I wanted to give you 3 rules of breastfeeding that no matter what is going on, we need to follow. And remember these 3 rules. Rule number 1 in breastfeeding is feed the baby enough. And that means, again, deciding, is this baby getting enough at my breast? That is the most important. I know that breastfeeding is the most important thing for this baby, or breast milk is the most important thing for this baby. For some reason and for some circumstances, mom does not have enough. I even hate to go there, and I'll talk to you a little bit about the reasons why in another video. But right now we have to be clear, is this baby getting enough? We're going to know if this baby is getting enough to eat at the breast is because this baby is going to be swallowing. That is something that we have to consider and are listened for. And they're swallowing consistently, not just here and there. It's a lot. And so having them swallow, they're going to be pooing and peeing. And they're going to be pooing and peeing consistently. This isn't 100% the for sure way, because I see babies who are extremely underweight, extremely pooing and peeing. And so usually not pooing enough. And sometimes they'll have enough pees, but they won't have enough poos. And so if we, during that first week postpartum, if you are viewing this, is this baby needs to have a poo and a pee for every day of life, which means if this baby is on day 3, we need 3 wets and 3 poos. On day 5, we need 5 pees and 5 poos. And then after about the 7th day, it's real common to have the poos kind of decrease a little bit to about, averages about 3 to 5 poos and 6 to 8 wets. And that's the way we want it. Now, a lot of babies don't have a really good pooing schedule. And if this baby's gaining weight and looking great, and you know you have gobs of milk and you hear it, and this baby's, again, getting bigger and not pooing, we know that that might be a little bit on the normal side in some cases. Now, we also are going to have some babies, which I see on a weekly basis, who are extremely underweight. And they're not up to either birth weight, and they're not even, and they're far out of, the 2 weeks. They're old, they're a little bit older, and they're not either up to their birth weight, or they're just barely past their birth weight. Or again, underweight. I've seen 3, 4, 5-month-olds who are pounds away of where the normal ranges should be. A lot of people go, well, normal ranges, who makes up these things? Babies need to gain weight. That tells us that they're going to be developmentally going to be on target. A lot of babies who are not getting enough to eat are going to cause sore nipples for their mom because they're going to try to instinctively try to get more out. They're also are going to give up a little bit, and their suck kind of gets to be a funky suck because they're not getting enough calories. And if the milk's not coming out as fast, then the tongue kind of stays behind, and then they kind of do a chomping rub, and then again they make the sucking be a little bit of a dysfunction. And that's not going to help mom's milk supply, or is it going to help baby get more calories? Babies need to gain 5 to 7 ounces per week. After starting from, of course, starting on day 5, this baby needs to start regaining its weight, not dripping down. At 2 weeks, we need to be pretty darn close to that birth weight or higher. And then from there on out, after that 2-week checkup, that baby needs to be consistently gaining weight 5 to 7 ounces per week. And if that baby is not gaining, and it's a lot less than that, and I even have some clients who are not going to their pediatricians in fear that their pediatrician is going to make them supplement. This baby needs to have food. And feeding the baby in some cases, 24 hours a day, and I have some clients who will do this, isn't in some cases going to help. Supplementing at the breast is going to help. And that could be with formula at this point, with the baby's so far behind birth weight and not catching up. We need to intervene. So either we're going to be pumping and pumping after every feed and feeding this to the baby with an SNS, or taking the baby away from the breast and doing some suck training and making sure that this baby is getting the calories that this baby needs. So that is rule number one. And again, I encourage you, if this baby, your baby, is not gaining weight or appearing to be emptying your breast or not seeing the poos and pees like we need to, and your nipples are raw, something's wrong. And we need to make sure that things are back to normal and can get back, and can get on the right track as soon as you can. So I encourage you to get that help and make sure that baby gets fed. Number one rule in breastfeeding. Number two is getting enough stimulation at the breast. So your breasts need to be stimulated at least 8, if not up to 12 times in a day. Now 12, as some of you, I hear you, I can't, 12. So 8 times is really adequate for most women. And 8 times, and having this baby breastfeed, and if this baby's breastfeeding adequately and efficiently, then your milk supply should come in fine and be great. If you are experiencing a lot of soreness, experiencing a lot of other issue, breast engorgement, or maybe not even engorgement at all, and the milk isn't coming in, then it's something, again, we need to explore with a lactation consultant. If you breastfeed this baby, breastfeed, and you are suspecting you do have a low supply, then what we can do first is we're going to pump after each feed, and then feed that to the baby, and then once a day, or at least on day 1, we're going to pump. Now this is going to be done at the same time. We're going to pump, let's just say at 10 o'clock in the morning, and in place of a feed. So let's just say you pump out and it's 2 ounces. And this baby's an older baby. Babies need way more than 2 ounces. So for 3 days, we're going to breastfeed the baby. We're going to pump after. We're going to feed that baby that extra milk. And if we need to use formula, so be it. In order for this baby, again, to go back to rule number 1, is this baby getting enough to eat? Then on day 3, we're going to pump again in place of a feed at the same time and see what our increase is and go from there. And if it is increasing, then we're going to be great. Then we can probably let go of some of the supplementation and pumping and whatnot and see how this baby does on their own. Sometimes we just need to break the cycle. And for also, again, getting enough increase of milk. A lot of people feel like, well, I need to be on herbs, I need to do this, I need to pump. Really, feeding the baby enough is going to be, in most cases, enough that you can do. Again, if you really feel like you have a low supply, then of course pump. But we might go the opposite and have engorgement issues and maybe have too much. So make sure we're clear on what the real issue is and whether your breasts are making enough milk. So number 3 rule in breastfeeding is getting the baby to the breast. Now a baby's going to go to the breast just fine if that milk is flowing fine. And most of the time we can get the baby to the breast without an issue if again, that milk is flowing nicely. So working on making sure a healthy baby is gaining enough weight and having a good flow at the breast is going to help this baby stay at the breast and want to be there. Because breastfeeding is natural. As for some, it's not. And I don't usually see natural breastfeeding issues because that's part of my job. as a lactation consultant is to see a lot of people going down the wrong door, opening the wrong door and going down a wrong path, just because there's just so many things that compound the issue. But hopefully this is going to bring you back. And again, feed the baby enough is number one. Stimulating your milk supply enough. So at least 8 times. Good stimulation 8 times a day. And number 3, get the baby to the breast, which is usually, again, it's going to be really easy if we do steps 1 and 2. So again, any other questions, then you're going to let me know, or you're going to hire a lactation consultant in your area to make sure that everything is going accordingly to plan, because I know it will with the right help.